It is very important to do x-rays of the coccyx or tailbone while a person is sitting down if they're having tailbone pain. And I'll show you an excellent example of that here within this video. I'm Dr. Patrick Fойе, and I'm an MD or medical doctor, and I'm the director of the Coccyx Pain Center or Tailbone Pain Center here in the United States. And I'm online at www.tailbonedoctor.com. Regular x-rays of the coccyx that you would get in most radiology centers or hospitals or doctor's offices are unfortunately done while the patient is either standing up or lying down. And that's a problem because for most people with tailbone pain, their pain is not worse while they're standing up or lying down. Their pain is worse while they're sitting. So the x-rays can be done while you are sitting, but unfortunately, more than 99% of radiology centers have never even heard about this, and they'll tell you that it's not possible, and they're just unfortunately wrong. Coccyx x-rays that are done while somebody is standing up or lying down can often look totally normal, even when somebody has a severe problem at their coccyx. And then unfortunately, the patient is told that there's nothing wrong with their coccyx. The seated x-rays, x-rays done while sitting, very, very often they will show substantial abnormalities that were totally missed on the other x-rays. And really having a specific diagnosis is incredibly important because that's what allows for a specific treatment in a specific patient. So extremely important to have the sitting x-rays done to detect the abnormalities. The way that these x-rays are done, this is just an image from my book. In chapter 16 is all about medical tests for tailbone pain, and here showing sitting x-rays for tailbone pain. And basically, the x-ray source is on one side. The patient is sitting typically on something hard, like a chair or a wooden board, and then the image is recorded on the other side. So while the person is sitting, and in fact, they would be sitting typically leaning partly back. And this image is, as I mentioned, from the book. So now we're going to look together at an example where the standing x-rays looked totally normal, but the sitting x-rays revealed a very dramatic dislocation. And this is something that I see almost every day here for patients who travel in to see me here at the Coccyx Pain Center or Tailbone Pain Center. So here is a x-ray that's done showing a patient from the side. So this patient is standing up. I'll hold up an anatomical model here showing the sacrum and coccyx. And in the side view, like this, the sacrum is up here. And then right here, these are the, between my fingers on the image here, these are the bones of the coccyx while the person is standing up. And then, actually, I'll point out one additional thing here is that while the person is standing up, the alignment looks essentially very normal. If I hold up a piece of paper here, just to hold it along the front wall of those coccygeal bones, you can see that they're nicely lined up. Or here, if I hold it along the back wall, the alignment is relatively normal here while the person is standing. And if that was the only x-ray that somebody had, they would be told that their coccyx looks fine and that there's nothing wrong with them. But here you can see what happens when the person starts to sit down. When the person is sitting, the alignment is no longer normal at all. You can see that this second bone of the coccyx has gone into approximately a 90% dislocation. This side to the right here where my hand is now is inside of the patient. Out here to the left where my hand is now is outside of the patient. So basically this bone has gone into a 90%, almost 100% dislocation where the bone is moving backwards out of the pelvis when the person puts some of their body weight onto that area. And here, while the person is not only sitting, but now they're sitting leaning back, it essentially has now gone into a 100% dislocation at that bone. And another way I can show this to you if the image is not already clear enough on the images that you've seen so far. Sometimes it can be difficult to see the x-rays clearly. Often what I will do for patients is to draw out the sacrum and coccyx on just some tracer paper here. So with the here just tracing, the sacrum is up here. Here is that first bone of the coccyx right here. The second bone is here, and then the remainder is down there. And if I hold a piece of paper behind that for a moment, you can see I've roughly sketched out the bones with roughly normal alignment as best I can draw on the tracer paper here. If I go to the next image here, while the person is now sitting straight up, again, if I draw that out here, and I'm just here outlining with a crayon on some tracer paper what's happening, the position of the bones. So I'm just outlining the edges of the bones. And if I slide my piece of paper behind there again, hopefully you can see now, what has changed in terms of the position of that second bony segment, which was in a relatively normal alignment on the x-ray a moment ago, now has moved into that, again, almost 90% dislocation here. And if I advance to that third image where the person is sitting leaning back, and again, I will put my tracer paper up here for demonstration purposes. And probably the best way to draw this will be right. So again, I'm just outlining roughly the edges as we can see them through the tracer paper. And if it wasn't already obvious a moment ago, it will be now. If I hold the paper up here, so you can see how this image where on the far left where I'm pointing here, the alignment looked essentially normal while the person was standing. And then while the middle image, while they're sitting straight up, you can see this starting to go into a dislocation. Not yet a 100% dislocation because there's a little bit of overlap between coccyx bone number 1 and bone number 2. Whereas here on this third image where the person is sitting leaning back, which is usually the most painful position for people with tailbone pain, you can see now that there's a 100% dislocation between coccyx bone number 1 and bone number 2. It's essentially has dislocated completely out of alignment with the bone that's above it. Okay, so that's information about seated x-rays of the coccyx. You can find more information about this on my website, which again is tailbonedoctor.com. You can also go to that site if you want information about coming in here for an evaluation for tailbone pain, which almost always includes the sitting versus standing x-rays. Or if you are in Paris, France, you can have them done by Dr. Main, who actually first invented these. If you're interested for more information about the book, which includes a whole chapter about testing for tailbone pain, you can search for that on Amazon. If you just search for tailbone pain and my last name, which is Foy, you should find the book easily there. So I hope that information is helpful for you. I get a lot of questions about sitting versus standing x-rays for tailbone pain, and hopefully from what you've seen on the images has shown you the importance of having those done so that you can have a specific diagnosis, which really then lays the groundwork for a specific treatment. Okay, thank you. Bye-bye.